Hello, I'm Dr. Christine Anderson. I am a chiropractor who is in Los Angeles. My specialty is pediatrics and pregnancy with a kind of subspecialty in functional neurology and childhood developmental disorders. So I'm doing this series on primitive reflexes, and today I'm going to talk to you about the symmetrical tonic neck reflex, abbreviated STNR, and it's also known as a crawling reflex that you're going to come to find out why it's called that. And in this video, you are going to learn why this reflex is important for a baby's and child's neurologic development, and why, if it is retained, it may cause things like poor posture, poor muscle tone, including sitting in the W position. Maybe your child's diagnosed with ADHD. Maybe they had crawling issues or didn't crawl at all, or a weird crawl. Poor hand-eye coordination and balance, learning difficulties, and reading difficulties. So this is what we're going to talk about. And if you are interested, I've also created a playlist. So if you go back to that playlist, I'll put the link to the playlist in the description, and it is going to include things like the introduction to the neurologic reflexes, where I go over not only the primitive reflexes, but also the other type of reflexes that you think of when you go to the doctor and they hit your knee with the hammer. So I talk about those. And then also just an overview of what primitive reflexes actually are and why they're important, and why especially they're important for our brain development. So I do highly recommend that you go back and watch those videos after you watch this one to get an overall idea of what this all is. All right, so what is a symmetrical tonic neck reflex? It is a reflex that actually is going to appear about 6 to 9 months. So babies, this is one of those weird ones where they're actually not born with it. It is sort of transitional between primitive reflexes and the more mature reflexes that we see. But in the top picture, you can see there the baby, when they put their head down, the arms are going to bend and the legs are going to straighten. So you can see there, they're kind of doing a little bit of a face plant. And then when they look up, the arms straighten and they sit back. So this is what's going to give that kind of a rocking motion on the hands and knees and get the baby ready to do crawling. So like I said, it develops about 6 to 9 months. And it is necessary for crawling because it is going to allow the baby to be able to get up on their hands and knees. And this is a huge feat because they have to defy gravity in order to do that. It is also going to bind the movement between the upper and the lower half of the body. In other words, they move together. They don't move independently, so that when that baby's head goes down, those arms are going to bend and the legs are going to straighten. That's a reflex. They have no control over it. And then that integration of this reflex is going to allow for independent movement of the top and the bottom half of the body. This is also a reflex, along with some others, that's going to assist in vision training. The near to far vision aspect, eyes crossing the midline, and especially in this one, hand-eye coordination. So what if your baby never develops this symmetric tonic neck reflex? What does that mean? Why would they not develop it? Well, we go back, at least in my world, I go back into what could be some stressors that might affect their neurologic development. And right off the bat, it could be when they're developing that inside mom's belly, there wasn't enough room to move around. And that can create all types of disturbances, not just with this reflex. Or maybe during birth, there was a difficult birth or birth trauma, or they had to use interventions. Sometimes those things can create issues and problems, not only with the spine, especially in the upper neck. That would be the upper cervical subluxation, a term chiropractors use when we're talking about misalignments in the vertebra, so that when the vertebra are not moving properly or fixed out of place, they are interfering with the nervous system. And in this case, especially with the brainstem, which is where primitive reflexes are located. And that brainstem is at a very vulnerable place in the upper part of the neck and coming out of the skull, the transition between the brain and the spinal cord, and also cranial issues. So that's the bones in the head, especially the occiput can affect it. And that's the bone right at the back of the head here. And I'll put a link in the description talking about craniosacral therapy for babies and newborns, where I delve more into this concept of cranial restrictions, so you can take a look at that. Now, because this comes on later, when babies are not allowed to move, in other words, they are put into what I call a contraption. And sometimes contraptions are necessary, like car seats when we're in the car. But if they're put in a car seat to go shopping and they're put into the car seat, they fall asleep in the car and it's brought into the home and they're sleeping in it, or swings, jumpers, saucers, boppies, infant recliner seats, even baby wearing. If it's one contraption after another and a baby is not allowed to be on the floor and move their body or have enough tummy time to actually work at pushing up against gravity, then they might not develop this reflex. And then also, if there's delayed milestones for whatever reason, it might prevent this reflex from actually appearing. And in this case, if there are any one of these things, whether there was enough room in mom, which might have contributed to a difficult birth, and this is the case really for chiropractic in pregnancy, by the way, a little shout out to that. But the brainstem compression, the upper cervical subluxation, this is where chiropractic shines, because if any of these are present and we can remove that interference, then there can be that free flow of information, and this reflex then might be able to appear. So this is why this is so important to get your babies checked out on a regular basis by a chiropractor who's trained in pediatrics, and especially with the neurologic aspects, so that they can check for this development, because this is something where I feel is a void in traditional medical paradigm. So having a pediatric chiropractor on your team is extremely valuable for neurologic development. All right, so your child is past the age of 1 when this is supposed to integrate, and perhaps it is retained, this reflex. It didn't go away. Well, what does that mean? So you can test this. And there's a couple of different ways to test depending on the age and size of your child. So if you've got a teenager, you're certainly not going to put them over your lap. It's just not going to happen. So if the child is small enough, you can put them on your lap and you can bend their head down. And if the reflex is retained, they're going to straighten their legs and they're going to bend their arms, and vice versa if you lift their head up. So you will see that reflex in action. If the child is older, you can put them on all fours, and then when they look up, they're going to rock backwards, just like that photograph or that illustration in the beginning. They're going to rock backwards towards their heels. Now, they may not go all the way back, but there will be some motion going back, or maybe their back is going to arch a bit, really arch. And then when they look down, they're going to rock forward. Maybe their elbows are going to bend, Um, and the legs will start to straighten. So you can see that in action of this reflex actually taking place. And again, like anything else, it will vary. They're not going to go completely having a face plant in most cases, but that is a possibility when they bend their head forward. And why is this so important? Well, remember, this reflex ties together the upper and the lower half of the body. So when it is retained, that means that there will be that connection no matter what. When the child looks down, they're going to have that action of the elbows bending and the legs straightening. So we want to separate the upper and the lower half movements so that you can use each half independently. It's not tied to the head movement. It's going to also be necessary for this reflex to integrate for the child to actually crawl. Because if they get on their hands and knees and they start to try and crawl and they move their head and the body follows reflexively, then they're not going to be able to crawl because they do need that independent movement. So what you might see is a child who walks on their hands and their feet like a bear. They call it like a bear crawl, or they might scoot on their butt. They might roll to get where they want to go. They'll figure it out. There's a workaround, but is it neurologically what we want to see? Or sometimes parents will brag, "Oh, they didn't crawl. They just went right to walking." And I'm like, okay. I have to let them down gently. That's not necessarily a good thing for the brain development. Or there might be a weird crawl where they're sort of army crawling and the feet are off the floor, or they may use one arm to crawl. It's, they will work around. Or I've seen this too, where they will just plop themselves down and sit and not move and wait for you to pick them up. So again, the importance of this integration is that we need it to develop that hand-eye coordination and vision and balance and all these type of things that are more mature functions and can only occur with the integration or occur fully with the integration. So what you might see in your child, if they're younger and not yet walking still, then you might see, like I said, an atypical crawl, or they lose their balance when they're trying to crawl, so they do like a face plant, or they don't crawl at all. You might see that they have poor hand-eye coordination and vision issues. So they might be like a messy eater, miss their mouth with the spoon, or they might have difficulty with sports, like tracking a ball and catching a ball or throwing a ball. You might label them clumsy. With the vision issues, they might have difficulty changing their focus from near to far. And that's what they need to do in school when they're copying from the board or a book, is they have to look back and forth, and they have difficulty doing that. So if they never crawled, they might have reading difficulties, or they might have difficulty aligning numbers to be able to do math calculations. So if they can't line those up, they're going to get the wrong number every time. They might have been diagnosed with ADHD or a learning disorder. And those diagnoses are not based on anything but subjective information. There's no particular lab test or anything you can do with those diagnoses. It's just gathering information and saying, okay, your child has a list of these issues, but really what's behind it is what I'm more interested in. And because of this aspect of the brain being able to organize itself for really the connectivity, there may be memorization challenges and just a poor learning ability altogether. especially in school because they're driven by this reflex. So they're trying to sit there, and every time they look down, their body's moving, and then they look up, and then the body moves again. And it's like they try to control it, it's even worse. Poor balance and coordination, socially awkward possibly because they might have difficulty reading social cues, poor space and time issues, and those two kind of go together. If you're not able to feel what's going on in your body, it's hard to read what's going out there in your world. And it also may result in poor posture and unusual gaits because of being driven by this reflex and your body trying to make adjustments. So let's take a quick look at that, what this might look like with your child sitting in school. So the top one is when they are sitting down in a chair. If they feel unstable, they'll hook their feet underneath the chair. So this is part of this retained reflex just to kind of stabilize themselves so their legs don't move when they move their head. Now on the bottom, you can see on the left-hand side, the child's looking down. So what does the arms want to do is they want to bend when they look down, and he's kind of slumped in the chair so he can extend his legs. And that way, the reflex is working for him. But then if he looks up, he's got to extend his arms to read, and then the legs can bend to actually sit in the chair. And some of these kids will actually sort of drape themselves over their desk to try and just have a workaround with this reflex. And with the unusual gait, it might even be something like a loping gait. If they're looking down at the ground, it almost like an ape-like walk where their head is down and their arms are sort of in front of their body and bent. So they're not having a coordination of moving the arms and the legs separately and more in a relaxed gait manner where the arms are swinging opposite to the legs. All right, let's get to some integration exercises. And in this one called Stretching Cat, you're going to try to sort of counteract what's going to happen with the reflex. So you start with the person or child on their hands and knees, and then what they're going to do is inhale there. And then they're going to sit back on their feet, but keep their arms straight as they bring their head down. Okay? So that's actually the opposite, right, of what the reflex is all about. So you're trying to integrate that reflex by telling the brain you want to separate that motion. Then you're going to have them come back onto that hands and knees position, inhaling again. So you want to do this 10 to 20 times per day and try to have them hold that motion with their head on the floor and the arms straight, sitting back on the heels for about 10 seconds. So slow is good. Another integrative exercise you can do is the cat-cow, which is very typical yoga pose, or you can call it the horsey as a fun name there. And of course, this one, you start on your hands and knees, and you can look down at your belly and have the back rounded, keeping the arms straight. And then as you look up, again, the arms still stay straight, and you don't want them to shift back and forth. You want their weight equal on the knees and the hands without the hips moving. And their back can arch a little bit here, but you don't want it to overly arch. You don't want it to overly hang down. So you want to hold each position, both cat or cow, for 10 seconds and do 10 to 20 times per day. So that is all about the Symmetrical Tonic Neck Reflex. And I've got all my information on the website if you would like to contact me to see more about how I can help you or your child with their whatever issues they have. It can run the gamut. It can run the gamut of social issues, learning issues, behavioral issues. I have seen so many things, and usually there's not just one because the brain is trying to do the best it can. So I have a lot of experience working with children, my patients and my own. And I am working to set it up to be able to help more people who are not in the Los Angeles area. So if you don't live here, don't think I can't help you. There is a way to do this now, so many ways with video remotely, or I can try and help you find somebody in your area to help do these exercises and or the chiropractic and the craniosacral work. So I hope you found this helpful. It really helps me if you give a thumbs up so I know this is something that's useful for you and helps to get more broadly out there in the world so other people can see it. That's my whole mission, is to help as many kids grow up as healthy as possible. And subscribe so that you know when I post a video. I do come on 6:30 p.m. Pacific time live. You can always watch the replay, but sometimes I do have additional videos that I post, and so this way you will be notified if you click that notification bell. All right, thanks so much, and I will see you next week for another video in this series of primitive reflexes, so stay tuned. Bye now.